Hi, I'm Anya Raisberg, licensed marriage and family therapist, and today I would like to talk about treating anxiety symptoms. I've been working with clients for a little over 15 years, and a lot of people have anxiety. Um, and treating anxiety is one of my passions. I had terrible anxiety when I was younger, and I've been symptom free for many, many years. And I've explored different things that can help with anxiety personally. So, a lot of the things I'm going to share with you are things that I have tried personally over the years of working on my own anxiety as well as treating my clients. Um, so the reason for anxiety, it's not very simple. There isn't any one thing. There are many causes. Sometimes there's different factors involved. There could be genetic factors and then biological, the way we're brought up. Like if you had an anxious parent, that can create anxious ways of thinking. And then as an adult, we a lot of times think the way that we were taught to think. So, certain health conditions can create anxiety symptoms as well as vitamin deficiencies. I always recommend to my clients to have some blood work done just to rule out any kind of conditions or deficiencies you may have. Get checked for thyroid, for, different vitamins that you might be missing. And there are multiple other things. Traumatic events can create anxiety. I had a client who was mugged at night, and then she just stopped going out and would just never leave the house in the evenings, which was challenging for somebody who was young and single. So, certain traumatic events can definitely contribute to anxiety symptoms as we get older. Um, as far as different modalities, so I use a variety of things. Everybody's very different, and there isn't any one way to treat anxiety that works for everybody. So it's kind of an exploration. Um, I use cognitive behavioral therapy, which is when we examine our thoughts and we replace certain negative ways of thinking with more realistic thoughts. I like to use this workbook, Anxiety and Worry Workbook. So it goes well with the CBT approach, has a lot of different worksheets that my clients can use. I also use dialectical behavioral therapy, which has some CBT components and adds mindfulness approaches. And I have a workbook for that as well. And there are lots of other helpful workbooks that I offer. And then my clients can choose if they, one, want to use a workbook, and two, which one they like. I also like this one, Heal Your Anxiety. Pretty basic, but for somebody who's never learned about this before, it can be really eye-opening. This was the very first workbook I've ever seen, gosh, almost 20 years ago, and it just was mind-blowing for me to learn about all the different things that contribute to anxiety symptoms. Anxiety can manifest differently for different people. So some people have worry about different things that they can't control. Some people have panic attacks. So periods where you feel like you can't function, you have very intense anxiety. Some people have more physical symptoms like restlessness, it's hard to breathe, you have tightness in your chest. For others, it's more their thinking patterns, like their mind racing, can be a combination of those. Some people struggle with social anxiety, so fear of talking to people, talking to strangers, talking to your classmates or coworkers. Some people have phobias, so it's a fear of a specific object or thing, like fear of flying, fear of, let's say, spiders, or I had a client who had a fear of cats, which get in the way of her visiting her best friend who had a cat. And luckily that was addressed. For that one, I used EMDR. Actually used the flash technique, which is a newer tool in the EMDR world. And 10 minutes later, she lost the fear and she could visit her friend. And same happened with my client with the mugging issue. It It was just 10-15 minutes an exercise, and she lost the fear, and she was able to go out and meet with her friends. Um, and it doesn't take away any anxiety that we should feel. So, going somewhere dangerous in the middle of the night is not a good idea. So, EMDR will not make you want to do that. It just takes away that irrational fear, the disturbance. So, yeah, there's so many different ways of treating anxiety. It's very exciting for me when my clients improve. If therapy alone does not work or does not decrease the symptoms, I do recommend an evaluation with a psychiatrist, somebody that can recommend the medication that might help you. There are lots of medications for anxiety that I have seen work really well. SSRIs, selective serotonin reuptake inhibitors. Those are the brand names are Zoloft, Paxil, Celexa, Lexapro. Those can work really well for some people. Those you have to take every day, and it takes about a month for them to kick in. There are other medications that are work differently and don't have the same side effect profile, like buspirone, Buspar, hydroxyzine can be taken as needed. There are certain beta blockers that can help with the physical symptoms of anxiety. Also, there's a class of medications called benzodiazepines, and those are Valium, Xanax, Ativan, Klonopin, Librium. Those are addictive if you take them on a daily basis. You can develop tolerance and withdrawal. So I don't recommend those every day for very long, but those can be great. Let's say if you don't have addiction history, let's say you have fear of flying, you fly on an airplane twice a year and you have that in your pocket. It's a really useful tool. Some of my clients don't even use the medication, just knowing that you have it can be really helpful. With medication, sometimes there's trial and error, so you may not find something that works really well, but it might take a while. Some people think that you either use medication or psychotherapy, and that's not necessarily the case. You can certainly use both. Medication is a tool that can work sometimes. And then in combination with therapy, I've seen really good results with my clients. So those are some basic little facts about treating anxiety. And if you have any further questions, feel free to contact me. Take care.